Yeah, so I will do again. So sorry.
You want to do it again?
Okay, here. My name is Hari. Hello everyone. Good morning. My name is Harikala Thapa and my student ID is 220705. Today I'm going to represent the presentations about female reproductive system, and firstly I will explain the anatomy and physiology of female reproductive system. Then I will discuss about the health disorder and treatment option available in New Zealand. Okay. This is the introduction. Here's the introductions of female reproductive system. The female reproductive system is a group of organs which is responsible for reproduction and hormone production and supporting pregnancy. Here is the anatomy and physiology of female reproductive system. It consists of two key components like external and internal. External, it consists vulva, clitoris, labia minora, labia majora, and labia majora. And internally, it consists ovaries, fallopian tube, uterus, cervix, and vagina. Here are some functions of external female reproductive system. The external female reproductive system consists of structures that protect internal reproductive organs, enable sexual functions, and support reproductions. Their functions include vulva, which protects the internal reproductive organs from injury and infection. It includes the following components: labia majora and labia minora. It encloses and protects the vaginal and urethra openings, help to keep the area moist and to reduce the friction as well. And the clitoris, which is highly sensitive organs involved in sexual arousals and during the sexual pleasure as well. The vaginal opening provides access to the vagina for menstrual flow, sexual intercourse, and childbirth. The Bartholin's glands, which is secrete the lubricating fluids. It is a small pea-sized glands, which is pea-sized glands, and which helps to facilitate the intercourse. Okay, this is the internal female reproductive system, and here we can see the ovaries. We can see the functions here. Ovaries, which produce the egg and female hormones, and here the fallopian tubes, where the sperm and meets eggs, and it goes down in uterus, where the baby is grown up here. And the cervix, which is plays a crucial role during the labor pain, which dilates and helps to come out the baby. And the vagina, it allows the childbirth, intercourse, and menstrual flow. Okay, here's the physiology of female reproductive system. We can see a graph here which explains everything, the fluctuations of hormone during the process of ovulation and during the menstruation period as well. We can see the ovary cycle, where is the growing follicle, and the ovulation period, which is here we can see the 14 days, which explain here the urine cycle. It's the follicular phase, it should be from 1 to 14, and the luteal phase, it is here from 15 to 28 days. And when the follicular phase, you can see the estrogen level going rise here and hit the high level, and during the luteal phase, the progesterone hormone will be high. It is released from the ovary hormones. It is released from the ovaries, and you can see here the anterior pituitary hormone, which is responsible to produce the luteinizing hormone LH, and the follicle stimulating hormones, which also helps to mature the eggs in ovaries. And during the 14 days, we can test here the ovulation. After ovulation, if the egg is not met with sperm, it will be disintegrate and it makes a corpus and corpus albicans. Okay. Then some health disorder of health female reproductive system. I will gonna explain polycystic ovary syndrome and endometriosis. Okay, what is polycystic ovary syndrome? Because polycystic ovary syndrome is a common hormonal disorder that affect individual with ovaries typically during their reproductive years. What is the reproductive years? It means 12 to 45 years of women, and it is characterized by a combination of symptoms and physical finding resulting from hormonal imbalance. Some symptoms of PCOS, it is irregular or missed periods, weight gain particularly in abdomen areas, excess facial and body hair, it is also called hirsutism, and the acne or oily skin, thinning hair or hair loss on scalp, difficulty for conceiving, it's infertility, skin darkening in areas like the neck, groin, and the under breast. Here are some treatment options which is available in New Zealand. We can see no, treatment options. Yeah, we can do lifestyle change to reduce the symptoms of PCOS, like healthy diet. We can follow healthy diet, regular exercise, and weight loss. The medications will be hormonal birth control, which helps to regulate the periods and reduce the symptoms. We can use metformin in improve insulin sensitivity during because metabolism is not going good, so there will be the insulin resistance problems. So to increase the insulin sensitivity, doctor may prescribe the metformin as well with the hormonal birth control pills. And the clomiphene or letrozole induce the ovulation. Anti-androgens, it reduces the male hormone effects, example acne or hair growth. Fertility treatments, we can use the IVF if pregnancy is a goal. It's mean IVF is in vitro fertility. All of you can hear like the test tube baby, where the we can make the zygote externally and put into the uterine. What is endometriosis? It is the another disorder of female reproductive system. Endometriosis is a chronic condition where tissue similar to the lining of the uterus in endometrium grows outside the tubes, pelvic lining, and other abdominal organs, causing pain, inflammation, and sometimes infertility. Some symptoms are pelvic pain, especially during the menstruation, heavy or irregular periods, pain during sex, painful bowel movements or urination, often during periods, fatigue, infertility, bloating or nausea, lower back or abdominal pain. Some treatment option for endometriosis. You can see here the pain relief, NSAIDs, ibuprofen, Nurofen, diclofenac, Voltaren. It is available in New Zealand. Prescription pain medicines like codeine, phosphate, opioids, which is the control drug, and hormonal treatments, birth control, combined oral contraceptives, patches, rings, microgram, and Novaring is the brand name of birth control combined oral contraceptives, and the progestin and Mirena IUD, Depo-Provera injection, Generax agonist, Zoladex, and Prostat. Surgery can be the another options for treatment. Laparoscopic surgery and hysterectomy are performed in hospitals by specialists. Here are some medicines available in New Zealand for endometriosis. We can see here the microguinon 30 mg, and it is the rings. It can be used if the persons are intolerant with the contraceptive pills, which is orally taking. At the time, this ring is used monthly. Okay, and the Nurofen, it is the anti-inflammatory drug we can use during pain. This is the IUD which have to insert into the vagina. Okay, that's it. This is the references. Thank you. Do you have any questions to ask? No? Okay.
Perfect.
Okay, thank you.